I'm happy to be here and to present you a bit more about about existential analysis. I came in yesterday. The purpose is that we start our training this weekend in London, and on this occasion, we had the idea to give another presentation of this approach to psychology and to human being, and to work with people and to work with oneself. My professional background is medicine and psychology. I did both studies because I couldn't decide which one I should do. I was so interested in who is the human being, and what is moving us during our life, and what really matters in life. And so I also combined both studies with philosophy, and did some studies in philosophy, and so this helped me a lot to get out of my own feelings of meaninglessness of my young life when I was 16, 17, 20, 21. I really suffered from this. What for all this? I'm thrown into this world. I'm here, but what is the meaning of all this? And this was the reason why I came to Viktor Frankl's books first, and then I was in his lectures, and when I was a student. And then I had the chance to know him personally, closely, and we collaborated for 10 years. Logotherapy is the name which Viktor Frankl coined for his development. He especially focused on the meaning, the finding of meaning. And he took the philosophical word for meaning, logos. It is the word, but it means also meaning in philosophy. And he said, logotherapy, we try to do therapy by helping people finding their meaning in their unique life and situation. And we cannot prescribe meaning, but we can help people to find their personal meaning for their situation. Nobody can tell me what is the meaning. I have to find it by myself. Logotherapy. Treatment through meaning. And he said, so for him, logotherapy was not an own psychotherapy, psychotherapy on its own. It was just a complement. It was thought to complement psychotherapy in general, because the theme of meaning was omitted in psychotherapy in the 20s and 30s and of the last century, and then again after the war in the 40s and 50s. And so he developed an anthropology, a concept of the human being, which put forward and put into the center the search for meaning. And he said, instead of looking for pleasure or for power, which is the Adlerian psychology, depth psychology, people primarily look for meaning. If they do not find meaning, they are not capable to do anything. We are not deliberately capable, and he showed that. We are not capable to act, to do anything, if we do not see a meaning in what we are doing. This need not be a consciously reflected meaning. This is most often an intuitively felt meaning, an idea that it is good for something. And he says, without this, we lose the picture of the human being. He thought mainly at hospitals, where doctors treated patients, not only psychiatrists, all doctors, surgeons, or in internal medicine. When doctors do not see that this is a suffering human being who asks the question, what for do I have to suffer this? And they can be become even suicidal if they have no idea, no answer, no assistance in this human search for meaning. Then he says, you are not a real doctor, you are a mechanics, a functional medical personality, but as a physician, you must see the human being and encounter the human being, and logotherapy is something which gives you, which provides you tools and ideas and visions how you can help people in such difficult life situations. This was his idea. So we see, trained in depth psychology, Frankl felt more and more and saw more and more that there is lacking something in psychotherapy if psychotherapy does not correspond to this very human question of understanding. Why? Why at all? What for? Should I especially undergo or bear some suffering, some pain or so? Existential analysis, Frankl already used that term, but only for the description of the theory, the philosophy behind the concept of the human being. In the development, we found that what Frankl brought is okay, but it needs, even this needs an enlargement, needs a broader basis. Frankl, for instance, did not focus emotionality. He was very cognitive, and he felt close to cognitive behavioral therapy, or at that time it was not yet cognitive, it was just behavioral therapy. He liked to argue, to give arguments, to give explanations, reasons, and so the own experience, the own feelings of the patient was not on his focus. He wanted to give them ideas, visions, a little bit philosophy for their life. And we said this should be enlarged by the development of a specific approach to the emotionality, to the own personal experience, how people feel themselves, and to work with their feelings and with their own view, and to help them to find their way. This is much more therapeutic. Frankl's approach is more counseling, is more helping, giving people tools that they can apply them. And whereas psychotherapy is not so much, it has something of counseling, of course, but it is more helping people to develop and find their own capacities by themselves, and to elaborate all the blockages and difficulties and sufferings and pains and traumas to raise up from themselves. This is a bit in difference to most humanistic approaches, like the Rogerians or so. They treat more or less all diagnoses in the same humanistic way. But we have modifications and have specific existential contents which are concerned in a specific diagnosis. And so we think we can work very precisely to the specific diagnosis, because we already know what is the existential content in it, and we have to elaborate it with the client or the patient. But EA looks deeper. It is an analysis of the conditions of a good life, of existence. We try to analyze theoretically and practically. Theoretically, in a general way, what is the human being, what does the human being need to come to a fulfilling life? What are the prerequisites? And practically, with the concrete client, patient, what is hindering you to come to a good and fulfilling life.
Just one example, maybe from your opinion, really interesting example. When you start maybe 30 years ago, 40 years ago with that client, and now you still sometimes working with him or her, but you can see huge differences, maybe changing life, maybe changing like perspective of
Yeah,
just
yeah,
example.
yeah. Maybe the longest client I had, I'm in contact with this client since 1992. There are few clients which have a long range of period, very severe traumatized people. This client had a depressive personality disorder and was absolutely suicidal. She came to me after she heard me in a conference. She was a teacher, and there I gave her a speech in a conference for teachers. And I got a phone call a few days after this conference by this person whom I didn't know. And she said, do you have time for me for therapy? And I didn't really have much time. I was quite full. But I heard the voice. And this was a voice which was almost dead. And this struck me so much that I said, without thinking a long time, yes. Can you come to me tomorrow? And she came, and she was really at the edge to commit suicide. And I worked with her, and she was suicidal for years, because in personality disorders, therapies last at least 5 to 7 years. And during this time, she was again and again suicidal. And I also applied medication, antidepressants. She was so depressive. We managed to do it, to not bringing her into the hospital, to do it outside of in the outpatient department or so in my practice. And she had absolutely no self-esteem. She felt as being the worst in the world and only a failure. All her brothers and sisters studied, she did not study, were successful, she was not successful. She couldn't bear the work anymore. She went into pension, into early pension, because I saw she was not capable to do it anymore. And now she comes, since years, maybe once a year, sometimes for a prescription, just briefly, but sometimes about once a year for a talk. She is a really happy woman. She helped in her brothers and sisters to come together. There were fights in the family. She was the one who said, we must sit together. She organized a moderator for there were 4 children to come together with the help of a moderator. So she is really the personality in her family. She was not successful in professional life, but she's successful in her personal development. And she is really the very much developed personality, highly developed personality in her family. And she has a really happy life. She still has to take a little bit of medication because of her personality traits. Sometimes she can stop it for half a year, but then in the fall, normally at this time, she has to take it again. This can be the case, but her attitude towards herself, towards her life, She can enjoy, she can live, she goes into concerts, in theaters, she has friends and relationships, and she lives alone, but this is really striking. So we can help people to overcome, to really continue a life.